want to be able to achieve is to improve the quality of life of people affected with diabetes. Therefore, accidents of geography and history should not determine who lives or dies. That is, if you live wherever you live in the world, whether you're poor or rich, you should have access to better diabetes care. And unless we have that, it means that there will still be people around the world who do not have proper access to diabetes care, and it means we are failing. The third thing is to ensure that we have global mobilization and awareness, and this is done through most of our programs like the World Diabetes Day. And where it is not possible for us to be able for the country to supply insulin, we have Life for a Child with Diabetes, which is our life survivor, where we adopt maybe we are now 9,000, 10,000, 12,000. We want to go to 30,000 children around the world where we supply them diabetes, supply insulin and others. So there are a few things we do. But also we don't forget the healthcare workers. Most of the world healthcare workers don't even know how to take care of diabetes. So we have guidelines, we have education material, models that we use to train these healthcare people on how to take care of diabetes. And lastly, governments. We influence government through WHO, we influence government through the United Nations, because it is only when we work with governments who are responsible for the health of its citizens that we'll be able to change the world for people affected with diabetes. And our heads of states and heads of governments to define how we can solve the problem in the world of non-communicable diseases. They kill 36 million people each year, and 18 millions of those deaths are premature and preventable. So we can save 18 million lives each year if we apply the measures. So, and we need whole societal, whole governmental approach. So the summit would define some outcomes that government must report on and implement. And we as civil society have to make sure that with our member associations, governments actually implement those outcomes, because we are expecting that at the summit, they will say every 2 years, for example, government must report back on the targets set from the summit. So we would make sure that what the governments are reporting to the United Nations is what is actually happening in place. So IDF, we think globally, but we act locally. Globally in our offices, but locally through our member associations. The change is already there, because through campaign, regional consultations, national consultations, people have already realized that diabetes kills 4 million people. That to solve the problem of NCDs, you must solve the problem of diabetes. That to manage to achieve the Millennium Development Goals, diabetes is one of them, and non-communicable diseases. So how would it achieve our goals? If we talk about healthcare system strengthening, it means that at the national level, if you strengthen the healthcare system of a low or middle income country, access to care for people with diabetes will be improved upon, and then diabetes patients will gain. It's a win-win situation. Ensure that everywhere, anyone who has diabetes is taken care of. Your voices can be heard. You are not a lone voice. It's together. When we join our voices together we are stronger. It means if you have not joined a diabetes association, you don't need to have diabetes to join the diabetes association, because you have family members, children, parents who have diabetes. Therefore, you can be an advocate for diabetes. Go join a diabetes association, make your voice heard, and collectively we can change the world. And the father could not afford insulin and diagnostic equipment because he had 5 other children, so you get was the third out of 6. So when I went for board meetings, my colleagues of the board members would contribute money. I go home, buy insulin. And the father was always, because he had financial problems, he was never smiling. He was always looking, depressed. But I came that day, I met him at the corridor. He was smiling, laughing. I said, "But what is wrong?" I said, "You have not heard." I said, "Heard will say you get is dead." I said, "But I told myself, but how come you get a child's daughter is dead, a father's daughter is dead, and he's happy?" Then I said, "No, this is curious." Then I said, "Okay, ask him why." Then when I asked him, he said, "Oh, it was better when Uget was alive The other children dropped out of school because he had no money to pay their school fees. They didn't eat in their home well because they had no money. Everything went on insulin. So the opportunity cost of having a child with type 1 diabetes in your family in most areas is such that parents would want the child to die so that the rest of the family can live. Can you blame them? Look for prevention and cure of diabetes, and they can be ambassadors. Be an ambassador for IDF. Talk about IDF. The International Diabetes Federation is your own. It's a patient organization where it's not an elitist organization. Be a member of IDF and change your local branch so that they become active and make sure that everyone who has diabetes has better care.